Hello everyone, and welcome back to another episode of Ask the Doctor. Today, we are speaking with Dr. Daniel Nicholson of the Northside Hospital Orthopedic Institute about ACL injuries. Doctor, welcome in. What is an ACL?
So the ACL is an abbreviation that stands for anterior cruciate ligaments. It's one of the ligaments in the center of your knee that connects the tibia, which is the lower part of the knee, to the femur, which is the upper bone in the knee. And the role of the ACL is to primarily stabilize the knee in a front to back plane. However, it also has a role in stabilizing the knee in rotation as well.
How does an ACL injury occur?
So an injury to the ACL occurs when the force applied to the ligament exceeds the strength of the ligament. So ACL injuries can occur either from contact or non-contact injuries. Non-contact injuries tend to be rotational injuries, where again, the force of the rotation of the two bones exceeds the ligament and causes the ligament to tear. Contact injuries are injuries that we often see when watching sports, such as football, where the knee is made direct contact with, usually coming from the lateral or the outside of the knee. And that force, again, causes a mechanism of injury that leads to tearing of the ACL.
How can an ACL injury be prevented?
So there are a variety of ACL injury prevention protocols which have been developed. Because we often see ACL injuries more commonly, well, I should say non-contact injuries, more commonly in females related to jumping, a lot of these prevention programs are based on correcting the mechanics of jumping in our athletes. There are braces that can be used that may help in some degree prevent ACL injuries from direct contact, and you'll often see athletes, particularly football players, wearing these braces underneath their uniforms. In addition to the ACL prevention programs, there are other strengthening programs that are aimed at strengthening the hamstring muscles of the leg. And the reason for that is the hamstring muscles actually perform a similar mechanism in stabilizing the knee in a front to back orientation.
Can an ACL injury be repaired without surgery?
So the general thought is that once an ACL is torn, it's always torn. It does not have the ability to heal itself. There are some new studies that are looking at what we call orthobiologics, such as PRP, or what is often referred to as stem cells, which may be able to be utilized in the future to actually repair an injured ACL. For patients who are not very good candidates for consideration of ACL reconstruction surgery, you can help to compensate for a torn ACL by strengthening the hamstrings, which again provide a similar function to the knee as the ACL itself.
What is an arthroscopic surgery?
So arthroscopic surgery is a relatively minimally invasive surgery that is performed through two small poke holes on either side of the knee. We use an arthroscope that physically looks a little bit like a metal straw, but it's a high definition camera and allows us to see inside the knee on a monitor. Although a minimally invasive surgery, we can do a variety of very complex procedures in an arthroscopic manner.
What is the most important goal for an athlete after an ACL surgery?
So what is deemed the most important goal would depend a little bit on where the patient is in the recovery process. The initial stage of recovery after an ACL surgery is based on trying to regain full range of motion. As the patient begins to normalize their range of motion, we begin to focus more on strengthening of the various muscles of the knee. In a patient who is an athlete looking to return to sport, the final stage of recovery is return to sport-specific activities.
What is the most important goal for a non-athletic person after an ACL surgery?
Certainly ACL injuries are not isolated to athletes. Everyday people can suffer an ACL injury just from their normal daily activities. Whether or not to undergo an ACL reconstruction is an important conversation to have with the physician. In general, if a patient lives an active lifestyle and wants to return to such an active lifestyle, we would generally recommend surgical correction of the ACL injury. The most important aspect of recovery would once again depend on the phase of that patient's recovery. The initial phase being return to full range of motion, the second stage being return of normal strength of the muscles of the lower extremity, with the ultimate goal to have that patient be able to return to all of their previous injury activities.
What types of treatments are available for an ACL injury?
Well, as I mentioned before, in general, ACL injuries do not have the ability to heal themselves. While there is current work being done looking at use of orthobiologics to potentially heal an ACL without the need for surgery, currently the two main modes of treatment are operative and non-operative treatment. Any patient who wishes to return to an active lifestyle, we would generally recommend surgical intervention. For patients who are either looking to avoid surgery or who may not be candidates for surgical intervention, non-operative treatment is certainly a reasonable option. One final surgical option, which will potentially be more commonplace in the future, is actually attempts at repairing the ACL. In this surgery, we would repair the patient's native ligament back to its insertion point. This was previously done in the orthopedic world, but the repair did not have very good surgical outcomes. By reevaluating the patients to determine who are appropriate candidates, there has been renewed interest in ACL repairs.
Thank you for watching and listening to another edition of Ask the Doctor presented by our friends at Northside Hospital, Cherokee.